Hello, welcome to my channel. I'm Happy Mama, and today I'll be talking about how I was diagnosed with autoimmune hepatitis. As you can see, today I have really bright makeup because I started to get paranoid that I'm a little bit jaundiced. Next month I have a checkup. And always before the checkup, I don't want to admit it, but I am nervous that some results will be bad, or it's just after checkup, everything fine, but every time I go for a checkup, I'm a little bit nervous, more or less. So I've noticed I'm a little bit jaundiced, and I didn't want to look at my face and scare myself in the mirror every time I see myself. So I was thinking I'll just put some bright makeup on to don't think about it. And I hope it's just Gilbert syndrome, which means that only the bilirubin is slightly elevated, but other enzymes are fine. So I hope it's just the Gilbert syndrome. I was diagnosed by accident. It was in 2004 when I was 21 years old. I went for surgery to get my wisdom teeth extracted. I didn't want to be awake in dentist surgery, sitting there and having my wisdom teeth extracted, so I wanted to be done under the full anesthesia. So I was in hospital, and I went for all the examinations before the operation, and then the doctor came and he said, "I'm sorry, but we have to reschedule it because your blood results are not okay. You have really low platelets, and that's not safe for surgery." He said that normal range is 120 to 450, and my platelets were only 80. So I was sent to hematology by my GP, and I went there for checkups twice a week. And the nurses, when they saw me third time, they said, "Miss, you have to be on diet and stop drinking alcohol." And I was surprised, and I smiled and I said, "I'm not drinking alcohol, and I'm living healthy lifestyle. I'm not eating any fatty foods. I'm doing sport." And I just thought that they mixed up the results, that they mix it was misplaced, that someone else's. But it wasn't someone else's. They were my blood results. And within 3 months I was sent to Prague to ICAM, or ICAM in English pronounced. It's the Institute of Clinical and Experimental Medicine, and there is a specialist hepatologist who is specialized on autoimmune hepatitis and other illnesses of liver. And I had an appointment with him, and he said he would have to be hospitalized here for 2 to 3 days to go for tests. So I was hospitalized for 3 days, and I had the first day I had done gastroscopy, but it was longer than the usual gastroscopy, just into the stomach. It went to the start of the intestine as well. So, and this one takes 15 to 45 minutes. So it was done under full anesthesia. And I just remember when I went for this test, I woke up in the middle of it and I started to pull the tube out of my throat because I started to cough and I was panicking, and the doctor said, please don't do it, you'll hurt yourself. And then I just remember they added more anesthetics in my veins, so I fell asleep again. And second day I had scheduled liver biopsy. At that time it wasn't available what's available now. Now it's available something called fibroscan, which is supposed to be less invasive. I don't know, I didn't have this done. But fibroscan and liver biopsy are tests to find out how stiff the liver is. But liver biopsy also can tell a little bit more about liver, because you have the actual sample of the liver. But it's quite invasive procedure. And before I tell you about the biopsy, I just want to tell you how I felt in that hospital, because the environment was like science fiction for me. Because until then, I wasn't really hospitalized. Maybe when I was a little child with some ear infection. Yeah, I had middle ear infection when I was a child, but I don't really remember it. So I was in a hospital and all the patients were really yellow, really jaundice. They were yellow like this duck, like really close to that yellow. And they all had ascites. Ascites is water in the tummy, and it happens when the liver is failing. So it was a very scary place to be, and I was just thinking in my head, this is how I'm gonna look like in a few months or in a few years. And I freaked out. And other thing was, I was sharing room with a lady who had infectious hepatitis. I don't remember which one was it now, but she told me she was infected after labor when she got a blood transfusion in 1980s. I don't know how this is possible, but they apparently didn't check the donor's blood for infections. So lots of people got infected by transfusion. And she said she didn't know about this years. She just found out when she started to have symptoms of liver failure. And she had to have this drained, this water from her tummy every 2 days or maybe every day, and it was very painful for her. and I thought she was 80 because she looked really skinny and really run down, and she was only 50 years old. So another thought in my head, I'm gonna look like I'm 50 in 10 years. I thought, and it was, that year was 2004 when I went for my liver biopsy. It was 13 years ago. So I hope I don't look 50. And I was 21 years old then. And until then I thought I'm a healthy young girl with a future in front of me, and I just didn't know how I ended up in there, and I was really, really scared what's gonna come next. So the second day I had biopsy, and before the biopsy I got local anesthetics, and the doctor said you just feel a little pressure in your liver. But it was a huge pressure, and it's paradox, but the local anesthetics injection was really painful, and I was just trying to breathe it through, and it was quite small needle. And then the doctor said, and now I'm going to show you the needle for the biopsy. And I said, no thanks, I don't want to see it. I'll be looking somewhere like at the window. Just tell me when you start. And after he finished, it took quite a long, maybe 10 or 15 minutes. I don't know, I can't tell because I didn't look at the clock and I didn't realize the time. I just wanted to have it behind me because it was quite unpleasant experience. And he said, lie down on your right side to stop the bleeding. And then he took the sample and quickly looked on it through, like against the light. And he said, it looks like cirrhosis. And I started to cry uncontrollably because I really thought, okay, so I have just like maybe a few months left or a few years. And then the nurse came and she tried to calm me down. She put the radio on and gradually I calmed down. And the last day when I was going home, they said that their suspicion, like the doctor's suspicion, was confirmed, and that it is autoimmune hepatitis because they found some antibodies in my liver, which means that my immune system thinks my liver is foreign body, and the white cells need to destroy it. And I didn't really understand it. I have never heard about this disease before, and to hear that the immune system is attacking own body seemed to me like complete nonsense. So I was really puzzled. But the doctor said, we don't know the cause of this illness. We don't know how it starts, but you may have it for your entire life, and you probably have it since you were a child because the inflammation progressed to cirrhosis. And cirrhosis, when liver is cirrhotic, there are scars on the liver that cannot be repaired, so the liver cannot recover itself. It's only in case of mild fibrosis or some mild changes when liver can repair itself. But when there is cirrhosis, it's just going to be the same, or it can get worse. And the doctor said that I'll get corticosteroids, prednisolone, 20 milligrams, and that they will try if this drug will help me, because in some cases it might not help, that some patients do not respond to this therapy. And she also said it has some side effects, and the main side effects is you're gonna gain weight. You're gonna gain weight mainly in your face and around your stomach. You're gonna be more hairy, and there is a risk of osteoporosis, so they gave me vitamin D tablets combined with calcium. And she also said that I have to be careful what I eat to don't develop diabetes, that there is also risk of diabetes. And that's what I got. And I also got Helicid, which is pill to protect a stomach. Before I took the prednisone, I supposed to take the Helicid to create a lining in my stomach, because the prednisone, it's quite aggressive. And that I should eat it with my breakfast around 8 o'clock. That it's it's the best to take it at around 8 o'clock, because it's also a hormonal drug, and the hormones are highest around 8 o'clock, the cortisone. And I was just asking my doctor, you know, it sounds quite bad, these side effects, diabetes and osteoporosis. And I read the, you know, leaflet, and the doctor said, look, you can choose. You will either take it, or I'll meet you next year and I'll be writing you on the bottom of the waiting list for liver transplant. And then I remembered the lady I was sharing my room with, and I was thinking, okay, this is not the option. There might be some alternative therapy, but a year, it's a short time, and these alternative therapies take years, they're slow. This is lethal drug, but it will quickly help me. So the doctor said, we'll see you in 3 weeks, and we will see if your body responded to it, and from there we will decide what we're gonna do next. And what happened next I will tell you in my next video, because this video is already too long. And if you watched it until now, I'm really grateful. Thank you for your patience. And I have also a recipe video for you. It's It's already done, but I just haven't uploaded yet because it's made up of 5 short videos, and I don't have any